I'm here with Dr. Spencer King, and we're talking about the new report about the FAME-2 study, a secondary report indicating that the economic viability of positive FFR stenting is real. Spencer, what's your take on this new report?
Yeah, so it cost about $6,000 more to stent the patients routinely than it did to stick with medical therapy. But after a year, you recoup about half that because of repeat interventions, primarily in the medical group. So the cost differential is rather modest, and for the benefit achieved, it comes out a little bit favorable toward stenting.
Spencer, the whole issue of which patients then should have a stent comes bubbling to the surface. Should you just simply cap patients to find a positive FFR lesion and then stent that, or what's the strategy that this kind of economic report supports?
Well, most of these patients in the trial had angina, most of them, so that's how we get started primarily. And the finding of the trial was that patients who had stenting did have a reduction in angina that was the best. It's not a license to stent things just because of the FFR, but the FFR is factored in. If you don't have a stress test, don't have a perfusion scan before or other positive stress evidence, the FFR can be very valuable to make sure that you're stenting the right lesion and that you have a high probability of solving the angina.
I think that's an important message, that in fact either this positive ischemic test non-invasively or positive FFR still allows you to go ahead and stent. And the bottom line here is reduction in angina, isn't it, Spencer?
That's right. And the concept that you have to have an exercise test to justify your intervention is not correct, because the guidelines clearly indicate that if you have angina, you have a documented FFR that's positive, that's a good surrogate for stress testing ischemia. So it's all in the guidelines.
So the take-home message here is that if you have a positive stress test or a positive FFR, stenting is appropriate. Not only that, economically, over the course of 1 year, it's a good strategy. For CardioSource, I'm Peter Ball.